Hi, you guys. Welcome back for our daily practice questions. It is day 283, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all of the resources that I offer. And I always like to direct you here to my business profile by simply going to Google and searching the Nursing Studio. It will bring you here where you can find my contact phone number, the link to my website, as well as testimonials from previous review students. All right, y'all. Question number one. A nurse practitioner educates a patient on the benefits and risk of starting statin therapy. The patient decides to decline treatment. The nurse practitioner respects the patient's decisions. Which ethical principle does this demonstrate? Is it A, beneficence? Is it B, non maleficence? Is it C, autonomy? Or is it D, justice? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which ethical principle does this demonstrate? All right, so let's see what's going on. So we have a nurse practitioner who educates a patient on the benefits and risk of starting statin therapy. The patient decides to decline the treatment, and the nurse practitioner respects the patient's decision. This is C, autonomy, giving the patient free will, full independence on their decision making, autonomy. Question number two. A nurse practitioner follows up with a patient for diabetes management using a plan of care created by the supervising physician. The physician is in the office suite during the visit. How should this encounter be billed? Is it A, under the NP's MPI at 85% reimbursement, B, under the physician's MPI at 100% reimbursement, C, under both provider MPIs, or D, not billable? Take a moment and tell me what you got. All right, so stem of the question, how should this encounter be billed? So we have an MP who is following up with a patient for diabetes management using a plan of care created by the supervising physician, and the physician is in the office suite during the visit. So we can bill under the physician's MPI at 100% reimbursement. So the best answer is B, because this qualifies as incident to billing. And lastly, question number three, which Medicare part covers outpatient services such as clinic visits, lab tests, and durable medical equipment? Is it Medicare Part A, Medicare Part B, Medicare Part C, or Medicare Part D? Take a moment and tell me what you got. All right, so here the stem is the question is the stem, right? So it states which Medicare part covers outpatient services such as clinic visits, labs, and DME. And your best answer is B. Medicare Part B handles your outpatient needs. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio. You can give us a call, shoot us a text message, or shoot us an email. And as always, everything that I offer is linked in the bio of this channel, including my website. And as I mentioned earlier, my website is also linked in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.